The CDC voted Wednesday to recommend the Pfizer vaccine booster shots for children as young as 12. The decision comes as the U.S. sets new records of daily coronavirus cases. The CDC says nearly 3.9 million cases have been confirmed over the past 7 days. The daily new case average is now 554,000. But the actual numbers are feared to be even higher as many Americans rely on home tests that aren't reported to local officials. Government data shows hospitalizations have also surpassed September's peak during the Delta surge. Many states are now seeing a steep rise in Omicron cases, including Florida, where cases have almost doubled in the last week. Manuel Bojorquez reports from Miami.
Tonight, Omicron's impact continues to be felt nationwide. The upcoming Grammy Awards are now postponed indefinitely after organizers said there were too many risks. The awards were scheduled to air on CBS at the end of this month.
Good morning, everyone.
There's news out of the CDC today. Children ages 12 to 15 could be eligible as soon as tomorrow to receive a booster of the Pfizer vaccine if it's been 5 months after their second dose. The agency's advisors cited rising infections in teens and young adults and a troubling increase in pediatric hospitalizations for the recommendation.
CDC surveillance data and other studies from around the world have demonstrated the benefit of a booster dose, including decreased risk of infection, severe disease, and death.
And as Omicron continues its record-setting pace, a new CDC forecast says cases and hospitalizations will likely increase in the coming weeks, with D.C., New Jersey, Florida, Georgia, New York, and Maryland seeing the highest rates. Infectious disease doctor Eileen Marty.
Way too many people are not taking it seriously.
New hospital admissions in Miami-Dade County are up 550% in just 2 weeks.
So many of our people are sick, not just the clinically facing staff, but even the support staff, the lab staff, etc.
As the hospitals get strained, there is less opportunity to provide all these resources to the one single patient.
Patients like 26-year-old Jada Turnbull, who says doctors at the Cleveland Clinic outside Miami saved her life after a 42-day-long battle with COVID last year. You had a 10 to 15% chance of living?
Yes.
And here you are. What words do you have for the medical staff?
Thank you. I cannot thank you guys enough.
We're also learning that data on vaccinating children 6 months to 4 years old could be released as soon as the end of March. Lana?
I'll be waiting for that, Manny. Thank you. The rapid spread of the Omicron variant has shut down the nation's third largest school district. Chicago schools closed Wednesday after the teachers' union voted to transition to remote learning. Charlie DeMar from our Chicago station WBBM reports.
It was a late-night jolt that ground the nation's third largest school district to a halt and sent parents scrambling to make alternate arrangements for their children.
I'm not prepared. I did hear about it in the news, but I just kind of assumed that they will find some way around it.
Chicago Mayor Lori Lightfoot canceled all classes, but threw parents a lifeline. She kept school doors open so children had a place to get their meals and stay if needed, but there would be no classwork, at least for the day.
When our district was fully remote, our children suffered. There's no disputing that reality. We saw triple the amount of failures in elementary school testing and learning. Triple. And that fell almost disproportionately on black and brown and poor kids across our district.
With only 33% of children ages 5 to 17 fully vaccinated nationwide, new pediatric cases continue to rise, and schools across the country continue to struggle with balancing student and staff safety with making sure the learning continues. Of the 5 largest school districts, only Los Angeles requires a negative test before coming to class. The others are opting for social distancing and masking. This morning, New York City's new mayor, Eric Adams, insisted the only option for the nation's largest school district is keeping the classrooms open.
The safest place for a child is in school. Little Johnny's not in school. He's not in his room. He's in the streets. He doesn't have his mask on.
Today in Philadelphia, nearly half of the public schools were forced to go virtual because of staff shortages due to the virus. Maya McGathy's 2 sons are now back to remote learning for the rest of the week.
This is beyond deja vu. We should already know what to do and how to do it so no one feels like they're scrambling. Parents have arrangements. Children have food. The satellite centers are opened up and properly done.
And the latest proposal is being reviewed by the Chicago Teachers Union. The aim is to address their main concern, which is health and safety, as new cases have reached a pandemic high in Chicago. Parents once again left waiting to hear if there will be a deal and if their kids can return to the classroom this week. Lana?
Charlie, thank you. For more, Dr. Sujan Gogu joins me now. He's a board-certified physician in family, sports, and pain medicine. Dr. Gogu, thanks for being here. So as we heard, Chicago shut down schools, and we're seeing record pediatric hospitalizations in the country due to COVID. Do you believe that school campuses are really the safest place for children to be at the moment, that in-person classes are better than remote alternatives?
I do think that in-person classes are good for children and should be recommended moving forward. We know in this pandemic, children have mightily suffered. Many children and teenagers are really experiencing mental health problems. Suicide attempts have risen. Gun violence from children has risen. And many schools have not really returned to normal, which has really costed them these children, learning loss and social isolation. And so ultimately, this has a longitudinal cost for a child as they develop.
Well, there's been a lot of confusion about the CDC's guidelines for isolation if you test positive, and that is fueling some of this discussion, and it's also independent of it as well. But 5 days of isolation if you test positive, but no requirement to take a test at the end of those 5 days to see if you're negative. Tell us, what are your thoughts on the CDC's isolation recommendation now?
Yeah, I do think that they should have recommended testing at day 5 and see if you do test positive or negative. If you test positive, then obviously you should isolate for another 5 days. And then if you test negative, I do think that you still should wear a mask, but that you're free from your 5-day quarantine. The CDC website, they also cite data from the United Kingdom that states that even after day 5, people are approximately 31% infectious. So I do think testing should have been required at day 5.
So there's still 31% contagious. I also want to be clear on one point. If you're still experiencing symptoms, because the guidelines right now are if your symptoms are abating, but if you're still experiencing symptoms after 5 days, should you re-engage or should you keep yourself isolated?
If you're still experiencing symptoms and you can't get access to a test, you should isolate for 5 days. You should presume that you're still COVID positive and you're at
5
risk
more days.
of putting. I'm sorry?
So just to be clear, 5 more days, you're saying?
Correct.
Okay.
Yeah, yep. You should isolate yourself for 5 more days. Absolutely.
You were saying because of the risks of infecting other people, is that right?
Correct. Yes. So if you test positive at day 5, you should really isolate yourself for another 5 more days, which would be a total of 10 days of quarantine. Because if you are symptomatic at day 5 and you can't get access to a test, you should just presume you're positive because you're going to be putting other people at risk. And many people in America, 40% of Americans have chronic diseases. 3% of people are immunocompromised. That's putting their lives at risk. If you become in contact with them symptomatic.
And Dr. Gogu, I'm glad you brought up this point about testing because millions of Americans are struggling to get their hands on tests. How is the lack of testing affecting our pandemic response?
I think it's mightily affecting it. I mean, I look at emergency rooms and primary care clinics, and emergency rooms are swamped with patients. Primary clinics are swamped with patients. And we got to keep in mind, there's just not COVID as a health concern for Americans. There's many people that go to a doctor, whether they need to get treatment for their heart failure, whether they need to get treatment for their hypertension, whether it's their diabetes and so forth. And it's really impacting other people getting the care that they need when people cannot get access to a test and have to go to the emergency room or go to the primary care clinic to get a test. So this is impacting the American healthcare system and people in dramatic ways right now.
Do you believe that our healthcare system was ready for this surge?
I do not think we were ready for this. I think we clearly don't have enough tests that are out there for Americans, and we see ERs that are swamped with patients. We see our primary care clinics that are swamped with patients as well. But more importantly, I think we should have expected this based on seeing what was happening in South Africa with the amount of caseload that they did have. They had a huge spike, and I think in America we should have expected the same, and we're seeing the same thing. So we should have had some measures prepared.
So given the high rate of community spread at the moment, do you think that the U.S. is moving towards herd immunity?
So regarding herd immunity, I think it's going to be very difficult to attain herd immunity for the principal reason that this virus is just rapidly changing. There's new variants that are always being created, and the vaccination efforts that we have, unfortunately, right now in America are very slow. If you look at how many Americans have gotten boosted, we only got 20% of Americans that have gotten a booster shot. If you look at how many people have gotten a primary series of vaccination, we only have 60% of that. And in terms of our children, and school-age children, we only have about 20 to 30% of kids that are vaccinated. And so in order for us to really get through this pandemic, we really need more people to get vaccinated. We need better therapeutics coming out, and primarily we need access to those therapeutics. Right now, many physicians don't have access to monoclonal antibodies. Many people still are having a difficult time prescribing Paxlovid. We don't have good ventilation in our schools yet. Our schools, for example, only 25% of them have a nurse that is there. So we have a lot of systemic issues that still need to be addressed for us to get through this together.
All right, Dr. Sujan Gogu, thank you for joining me, and thank you for all that you do.